Hello, everyone. I'm Dr. Marty Ross. I'm very sorry for the delay here tonight. As you can tell, I had some technical difficulties. I actually inadvertently killed the whole webinar, and once I do that, there's not an option for me to turn it back on. So I did have to go ahead and reset up a new one. So I'm glad to see that many of you were able to follow me here. The webinar we have, although it looks the same to many of you that have attended here before, actually this is a different setup, and I'm going to be able to repost your questions tonight, which we haven't been able to do before. And so what I'm going to do is we're going to take these questions one at a time. I'm going to post them actually so that each of you can see what those questions are. If you were in the old chat room, you will need to rewrite your question to me down at the bottom of the screen, okay? All right, so let's go ahead and get started. I'm going to post the first question. So I think I'm going to post the first question. All right, so the first question is, hi, I've been diagnosed with fibro, but not sure I can get better. Looks like I've posted from the same person here. This is new for me, everyone. I got to see how this works out. I've been diagnosed with fibro, but not sure I have after reading Why Can't I Get Better and talking to one of your patients. If I am on a lot of painkillers, oxy and hydrocodone, how will I work with you to see if I have Lyme, the meds right away? All right. So everyone, those are the questions for this first person. So let's talk about how you diagnose Lyme disease, okay? So first of all, I practice in Seattle, Washington, and at one time, my practice was exclusively a practice devoted to taking care of people or helping people that had chronic fatigue syndrome and fibromyalgia. So I'm in Seattle, Washington, where compared to the East Coast, like New Jersey, where the ticks have been tested, it looks like 95 to 100% carry Lyme. It's probably not that high out here, but we still have ticks that carry Lyme. And so in my practice, one of my patients about 10 years ago asked if I would test her to see if she had Lyme disease. And this is one of my chronic fatigue and fibromyalgia patients. What I found is that her test came back positive, and it was an eye-opening experience. I decided to go back and retest every one of my patients then. And so what I found when I retested my patients, actually not even retested, I tested them for the first time for Lyme disease, I found that 30% of my patients that I had diagnosed previously as fibromyalgia or chronic fatigue syndrome actually had Lyme disease as a cause of their problem, all right? So that was an eye-opening experience. So what I want to let you know is that what some people call fibromyalgia and what some people actually call, I see now that broadcast on the bottom of the page. I'm not quite sure how that happened. Anyhow, so what some people diagnose as fibromyalgia or chronic fatigue syndrome may actually be Lyme disease. Okay, so how do we figure it out? Well, when we're trying to figure out if somebody has Lyme disease, there's 4 things that we look at. Number 1, what are the risk factors of getting it? Okay, so for instance, if you live in New Jersey where 100% of the ticks, 95% of the ticks carry Lyme disease, you have a high possibility of getting Lyme. If you're a deer hunter, you have a high possibility of getting Lyme. If you are an outdoors person that goes into the brush quite a bit, there's a good possibility that you could get Lyme. Basically what we do is we look to see what are the risk factors, okay? Now, having said that, I do want to let you know that when somebody has, in terms of getting Lyme, although the predominant view is that it's all spread by ticks, 50% of the time that people, and so that leads many of us to wonder if there might be other vectors that can spread it. So European studies suggest that fleas carry it, mites carry it, mosquitoes can carry it. There's a lot of other vectors that might carry the illness, okay? I'm sorry if you're seeing me distracted. I'm trying to figure out how to work with this new webinar tool tonight. But anyhow, one, we look at the risk factors. Number two, we look to see, do you have symptoms that are consistent with Lyme? Number three, we look to see, are there any physical exam findings? And number four, we look to see, do you have any supportive Lyme test, okay? So this is all kind of a complicated topic, but I think what would be best for me to do is to show you a resource on our website, and to do that, that you could all take a look at later to help figure out if you have Lyme. To do that, I'm going to do a screen share here. All right, let me get over here. Okay, so this is a screen share that I'm doing with everyone tonight. All right, so this is our website. This is the Treat Lyme book. This is where we have most of the information on Lyme disease, okay? And in our table of contents, there is an area, these are our chapters, and one of the chapters that we have is one on diagnosis, okay? So this is called How to Diagnose. All right, and in this How to Diagnose, there is actually an article on how to diagnose chronic Lyme disease, okay? And so it is more than a test. That's what we put down, all right? And then you're gonna see this is actually a video article, all right? So I would take a look at this. I don't wanna spend the whole webinar tonight going over how to diagnose Lyme, because actually I created almost a 30-minute webinar on this before, but take a look here, and I think you'll get some good insight on how to figure this out, okay? All right, so let me move on to the next question here. All right, let me go back. There's one other thing I need to do to make sure that I am able to give you all the information you do. I'm trying to, again, it's a new webinar tonight, everyone, a webinar. They've redone the webinar program, and I'm trying to figure out how to work with it. So there's one other thing I need to look at here. Just a minute. I need to pull up a different screen, apparently. Okay, so let me go ahead and move on here. Okay, so next question is from Sue. Let me go ahead and post that so everyone can see it. Okay, so Sue says, if you are born with Lyme, will you have it forever? Ah, okay, I see how that shows up. So I guess I can have it show up actually as an overlay that you can all see. That's good. I think actually I like that. Okay, so if you're born with Lyme, will you have it forever? So Sue, this is a kind of a complicated topic. So when somebody is born with Lyme, it is possible, if it is discovered that maybe within the first 3 to 6 months, that it can be eradicated. In my opinion, if it's discovered at a year or more, probably it is not eradicated. We can't get rid of it, okay, unfortunately. And so it is something that might be with somebody for the rest of their life, okay? And that is probably the best we can say. It's based on my experience. I do definitely know from an adult population, as well as kids, that when somebody's had this for a year or more, the best we're probably doing is knocking it under control, and anyone would be subject to relapses in the future, okay? All right, so thank you for that question. Let me go ahead and move on. Okay, next one is from Kim. Okay, so Kim, let's see. Hello, Dr. Russ. I was recently reinfected, and my current regimen is amoxicillin 500 milligrams, 2 caps 3 times a day, doxycycline 100 milligram, 2 caps twice a day, and hydroxychloroquine 200 milligrams, 1 cap 2 times a day. And let's see, I am also taking 30 drops each of Banderol and Cemento. Oh, I see you posted this in. Okay, so let me go ahead and get that next part posted too. Is it necessary for me to take the hydroxychloroquine if I'm taking Banderol and Cemento, in your opinion? How long should I continue this regimen, assuming I caught the infection within a few days of the bite? Thank you so much. You're welcome, Kim. So let me go back here. I need to look at what your other question, the first part of your question was. So I'm going to probably repost that. Let's see. Doxycycline. Okay. So Kim, I guess there's, in terms of what to do with acute Lyme, I like Banderol Cemento for sure in people that have chronic Lyme disease. In my opinion, those two herbs in my practice is that they work about 85 to 90% of the time, which is the same success rate that I would see with any prescription combination as well too. Okay, so they're good definitely in chronic Lyme. The trouble is we don't have an adequate information working with them in an acute setting right after you get a tick bite to know if they're going to be successful at getting rid of Lyme. Okay, we just don't know. And so typically what I like to do in my acute tick bite situation, somebody that's gotten Lyme or has a tick bite, they come to see me within a month or I like to work with doxycycline. And I like to use it as a 100 milligram pill, 2 pills twice a day, just like you're doing. The reason to use it is it gets rid of Lyme, but it also can help treat in an acute setting co-infections. It could get rid of Bartonella. It could help treat Babesia. It definitely gets rid of 2 other ones called Ehrlichia and Anaplasma. These are other germs that can get spread by setting. Actually is doxycycline. I often will also include grapefruit seed extract. That's 250 milligrams 2 times a day. Grapefruit seed extract is an herb that does quite well at getting rid of the cyst form of the Lyme germ. Okay, now in an acute setting, you may not need to worry about that, but I throw it in for safekeeping. The other thing that I like to do is to work with probiotics to help prevent yeast from setting up in the intestines as well too. I don't think you need the hydroxychloroquine, not in an acute setting. The doxycycline by itself will work well. The hydroxychloroquine is also known as Plaquenil. There's 2 things, or a few things that it can do. Number one, it's a good anti-inflammatory, okay? In Lyme is that it lowers acid levels inside of cells, which can cycling work better. But at that dose, the 100 milligrams, 2 pills twice a day, I don't think you need to help it work better. I think it's going to work quite fine on its own. And then some of my colleagues will also use it to treat the cyst form of Lyme. But to be honest with you, I don't find it that helpful. And there's actually competing studies that suggest that perhaps Plaquenil, hydroxychloroquine, may even cause increased cyst formation, okay? So it's not necessarily a good idea to go ahead and be on that. And so I don't recommend that at all right? So I wouldn't do that. I would actually go to the prescriptions, and I don't think that using enough of a track record to say whether it's going to eradicate your infection. All right. And that ultimately is what you want to try to do in an acute setting. Okay. All right. Let me move on. Thank you for that question, Kim. All right. Let's see here. All right. Let me go back here. Okay, next question is from Jennifer. Let me go ahead and post that one up. Okay, so Jennifer says, hi, Dr. Ross. I have these small pinhead red marks over my torso, legs, and arms, and have been told they are Babesia. They seem to be getting worse with treatment. Is that a sign of the treatment working or, heaven forbid, not working? Do these ever go away? All right. So, Jennifer, let's talk about that. I wish I actually had a picture of this, but when a person has Babesia, it is possible to get a bunch of red marks, a little bit bigger than a pinhead, but itself. And they're cherry red. I mean, they're like what the red you would imagine blood to look like, okay? Which is a brighter color, for instance, than when you get pimples, okay? That kind of red, all right? So Babesia can give you these red spots. They will come and go during a treatment. And if you're being treated for Babesia, I have seen them get worse at first in a Babesia treatment. But if you're getting more, I often will want to be careful and shift my treatment to possibly even use a different malaria medicine, because everyone, we use malaria medicines to actually treat Babesia. But I would wind up possibly to give additional coverage using additional things to the one thing or two things I might be using for Babesia, okay? I don't, it could be a sign it's not working. It actually may be a sign that it is working, okay? Now, other rashes that people can get that aren't necessarily Babesia, you can get like red spots that look like pimples or that look like eczema, not that bright red, but just red bumps. That you can sometimes see with Bartonella, and those kind of rashes you can sometimes also see with Lyme infection too, okay? So I hope that gives you some information, Jennifer. I actually want to go ahead and do a screen share here because what I just mentioned, and many of you know that what I just said is that there are different ways to treat Babesia. So I'm going to do a quick screen share. I'm going to show you the Treat Lyme book. And we're going to do that so that I can help you find the article that we have written about how to treat Babesia. Okay, so let me go ahead. I'm going to do the table of contents here. We're going to go to the infection treatment plans. Okay, and there is a that we have here on how to treat Babesia. Where are you? It's called Kills Babesia Guide. Okay, and what I want you to know in this is a pretty comprehensive article. I've got a section called Tier 1. These are the treatments that I think work about 85% of the time, and they happen to be drug-based, and they usually use two things at least, okay? So one is to use a combination as a tovacone and proquinel. This is also called Malarone. I talked with you about how to do that, and you might want to combine, or you would combine it with the Zithromax and Biax and a doxycycline or minocycline. Okay, I tell you how to do that here. Or another one to use that I put in this Tier 1 is to use Mepron, also known as a tovacone. Again, you would include it with the Zithromax, the Biax, and doxycycline or minocycline, all right? In Tier 2 are the herbal treatments, and this is, these work about 75 to 80% of the time. This includes the Chinese herb artemisinin, which I like to use at pretty high doses for 3 days on and then take 11 days off. I know that some of the doctors, like Dr. Horowitz on the East Coast, thinks that it is not working that effectively anymore. But I want to let you know is out here on the West Coast, and actually for my patients that come from Canada, I find that it's working quite well. And I think it may be that we've got different Babesia strains in different parts of the country, okay? And I can't speak about a European, I just don't know. The other thing I like to do is a Tier 2. There's another prescription antibiotic called Lariam, also known as Mefloquine. I usually would combine it with the Azithromax, the Biax, and doxycycline. However, Mefloquine I don't like as a frontline treatment because it has a lot of psych side effects, okay? And then the other one that I like to put in Tier 2 that is an herb is the Cryptolepis. Cryptolepis is an antimalarial herb that comes from Ghana. This works about 75% of the time. I sometimes even like to add it to the Malarone and Mepron combinations up above, but this can work quite well. It's got a very, very strong taste, okay? And finally, into Tier 2, I would put something called Coartem. You can read about it here. That's a prescription, all right? And then kind of the Tier 3 treatments would be the things I would use if everything else fails. One of those is a medicine called Alinea, and I have it listed here by the generic name, right? And that can work fairly well, but it's really expensive, and you're going to need to use it for about 5 months and run about $1,200 to $1,500 a month. Okay, so that's a little bit prohibitive. An older line way of treating Babesia is to use something called clindamycin and hydroxychloroquine, which is a quinine-like medicine, or to use quinine. And if you do these, they work 75, 80% of the time, but there's a lot of side effect problems with them. And I list those side effects down here. Okay. So anyhow, this is the article on how to manage Babesia. I just wanted to give you a quick walkthrough of it, because based on my previous comments here, you may think about how to treat it. So let me go back here. All right. So thank you for that question. All right. Hello, Sue. Let's see here. Our grandson is being treated for Lyme and co-infections. And Bactrim daily, Tindamax on weekends. He just got another tick bite on his head. He's 4 years old. What should we do? How should all of us deal with future tick bites if we have them? Okay, so Sue, I just looked back through that question again. So first of all, thank you for that question. So in my opinion, when someone antibiotics during that treatment, the chances of them worsening from a new tick bite is quite small. In fact, the antibiotics that they're on likely prevent that infection from taking hold. Okay, so the treatment that your grandson is on with the clarithromycin, which is also cellular Lyme. Okay, so everyone, Lyme lives in you in 3 forms, and this antibiotic treats 2 of the forms. The 3rd form is something called a microscopic cyst form. The Tindamax will actually help take care of that. And then the Bactrim, along with clarithromycin, son is on, takes care of Bartonella. That's a good Bartonella treatment. And then I don't see, it doesn't look like there's being anything done for Babesia here, but it doesn't necessarily mean that you need to with an acute tick bite. So anyhow, what I would do with the situation, your grandson's already covered. I don't think you need to do anything in addition to what you're doing with these antibiotics at this point. Okay. All right. Thank you for that question. Okay. So the next question is from Sally. All right. So let me go ahead and get that question posted. Hi, Dr. Ross. I treated Lyme for a year. I am now treating a flare-up. When I take Ceftonir, my Lyme symptoms return. Since I am a tennis coach, I have trouble taking Doxy due to sun sensitivity. Is there an alternative antibiotic that may be as effective as Doxy? Okay, so all right, so Sally, let me just talk briefly about relapses and what you need to do if you get into a relapse. Okay, so first of all, if you've had Lyme and it was adequately treated, over a 5-year period of time, if you've had Lyme for more than a year, over a 5-year period of time, there is a chance of relapse occurring, okay? So there are some things you need to do at the end of treatment to try to prevent relapse. I'm going to show you an article in a minute that'll go over what those points are, okay? Now, if you get into a situation where you start to relapse, where it looks like your symptoms of Lyme are coming back, whatever those symptoms are, the first thing you want to do is to try to figure out, is it really Lyme or is it a co-infection, okay? But the main thing that I actually see in my practice is about 90% of the time it has symptoms that look like a relapse. It actually is that they have too many yeast growing in their intestines, okay? Now, I know that may seem kind of far-fetched, but just hear me out on this, okay? So if you've been on antibiotics and then you stop getting treated, even if you were on anti-yeast medicines during your treatment, even if you were on probiotics, you are still a setup at the end of treatment for developing too many yeast in your intestines. So as most of you know, your intestines have yeast and bacteria in there, okay? So if you've been on antibiotics and those yeast get knocked, or the good bacteria gets knocked down, yeast can overgrow. All right, now, when you have too many yeast, they release toxins that can make you feel badly. And the immune system will react to taking inflammation chemicals called cytokines, okay? And cytokines are good and bad, but they're also made in excess when we have Lyme, all right? So in Lyme, when you have Lyme, your immune system tries to get rid of the germ, makes cytokines. Cytokines are good. They turn white blood cells on. They create more white blood cells, and they help draw those white blood cells toward the good. But the immune system does a rotten job getting rid of Lyme, and eventually it makes too many cytokines, okay? And too many cytokines essentially give you your Lyme symptoms. So cytokines make it so you can't sleep. They give you brain fog. They make it so you can't think. They make you hurt. They can make your nerves not work correctly. They cause basically most of the symptoms that we call Lyme disease. And in fact, when we say somebody has Lyme disease, what they actually have are excess cytokine symptoms, okay? That's what Lyme disease is. It's a syndrome of excess cytokines, all right? So what we do when somebody looks like they have a relapse, I want to figure out if they've got another of those excess cytokines, okay? And so the main cause of excess cytokines, and that occurs 90% of the time, is too many yeast. So how do you figure out if you have too many yeast? Well, what you can do to figure out if you have too many yeast is look at these following questions. Number one, do you have increased sugar cravings? Number two, if you have something that has a lot of sugar in it, do you feel worse afterwards? Number three, do you have a lot of intestinal gasiness and bloating? Number four, do you have rectal itching? Or if you are a woman, do you have any vaginal itching or vaginal discharge? Number five, do you have symptoms or new skin rashes or increased acne? And number six, do you have difficulty swallowing, or do you have white patches in your mouth? Okay, so those are things that can suggest too many yeast. If you do wind up having that, then you should treat for the too many yeast. Okay. All right, and then let me see the other part of your question. All right, so if you truly do have Lyme as a cause, if you've looked at the Bartonella symptoms first and figured out it's not Bartonella coming back, or if you've looked at the Babesia list of symptoms and you figured out that it's not Babesia coming back, because you should also look at that, then it looks like Lyme, okay? Now, when you treat Lyme on a relapse, you need to make sure that you treat for all three forms of the germ, okay? Again, that's the spirochete, intracellular Lyme, and cyst Lyme. Okay, those are the things you need to make sure that you cover for. All right, so the ceftonir that you talked about is only good for spirochete Lyme. You've done nothing for intracellular Lyme, and you've done nothing for cyst Lyme. The doxycycline is good for spirochete Lyme and intracellular Lyme, but does nothing for cyst Lyme, okay? The way that you could take your ceftonir, if you want to use that and not have to worry about sun sensitivities, you could combine it with either Flagyl or tinidazole. Those are great cyst busters. They treat intracellular Lyme. And the tinidazole is probably my preferred one because it also removes biofilms, okay? So there's good experiments to show that it can remove slime layers that cover the germ that block the treatment, okay? All right, so that's what I would look at. I don't, if you want to not be on doxycycline, you're okay, but then see if your doc would add some tinidazole to the ceftonir, okay? Let's see, and if your symptoms flare up on the ceftonir, it may be that you're getting a Herxheimer reaction, okay? The reaction everyone is the immune system sees dead bug parts or sees toxins that get released from the inside of the germs. It releases more cytokines. And as I just said, Lyme disease is a syndrome of excess cytokines, okay? All right, so there's a number of things that I want to show you. I want to do a screen share here because I'm going to go back over some things that I was just talking with you about, okay? All right, so let me do that. Okay, so number one, as I just said, if you get into a relapse, there is a good possibility that the relapse can be due to too many yeast, okay? So how are you going to figure that out? Well, as I said, there's some things you can look at, but look at our here. We've got a little video that I've put up there recently. I'm trying to add to this, okay? But take a look at this article, Is It Yeast, okay? And it gives you ideas that I look at for clues about when it might be yeast or not yeast, okay? All right, wondering, as I said, you also want to make sure that it's not Bartonella or Babesia, all right? So let's go over your table of contents again. Look at this chapter on how to diagnose, all right? And so you want to look at, is it possibly Bartonella or Babesia? The way that I like to look to see if you have Bartonella babesia is to look at the symptoms and the signs, because testing for Bartonella and babesia is pretty poor. Okay. So look here, I've given you a list of this article about Bartonella symptoms, babesia symptoms. See if it looks like some of these have come back or not. Okay. All right, then finally, let's talk about what to do at the end of treatment to prevent relapse. Okay. Let me see if I've got it here. So there's a chapter we have on relapse, and there is an article we have called Finished, How to Prevent Relapse, okay? We even got a video that goes with this. So you can take a look at that later if you want to. And so we need to do things to help to keep the immune system working well, okay? And so at the end, take a look at this whole article. There's a lot of detail in here, but there's things that I recommend that people do at the end of treatment, okay? And one of those is to get regular sleep. You want to do regular exercise, eat whole organic foods, don't put more poison, be in a good multivitamin, and support your immune system by either using transfer factors, okay, or by using mushrooms, okay? And also deal with emotional toxins, all right? And then sometimes if I've had a person that relapses easily, I might leave them on an herbal antimicrobial like a Banderol Cemento, or I might put them back on prescription, a single prescription antibiotic to prevent that relapse as well too. Okay, I lay it out all in this article, okay? All right, so let me go back to the webinar. Let's stop screen sharing here. Okay, so here we are again. So thank you for that question. And let me go ahead. So our next question is from Jane. All right, so let me go ahead and get that posted here just a second. Okay, so this is a question from Jane. And she says, should you space out taking probiotics when taking anti-parasite meds? Okay, that's a good question. Okay, so let's look at what probiotics are. So probiotics, typically the majority of type of probiotics that we have are probiotics that include similar live in our intestines. Okay, so these would be things like Lactobacillus acidophilus, Lactobacillus bifidus. Those are the main ones. And there's other, you can find other bacteria in those type of probiotics, but usually there's going to be some type of a lactobacillus in your probiotic product, okay? Now, those bacteria are not going to be susceptible, are not going to be hurt by having anti-parasite medicine. So you can take those type of probiotics with anti-parasite medicines, all right? But these days, I'm starting to move away from using the acidophilus-based probiotics. I think there is a better way to go. And I'll show you the link to this here in just a second, okay? But the better way to go is to work with what are called soil-based probiotics, parasites that come from the soil. Now, why would we want to do that, all right? So what's happened is there's good studies that show that probably over the last 100, 200 years, the type of bacteria that live in us have shifted, have changed from being more closely related to what's in the soil to what we have now. Soil actually do have some benefit at turning on the immune system. They regulate the immune system, okay? Including the parasites. They regulate the immune system, all right? And they don't get destroyed in the stomach, so you don't have to worry about taking billions of them the way regular probiotics. And in my opinion, they seem to do a better job getting rid of yeast, keeping yeast from setting up shop, okay? So let me show you what I recommend. And on this one, actually, I can recommend a product. And I'm going to show you, let me do a screen share to show you that. Okay, so I'm back in the Treat Lyme book. All right, I'm going to go over here to the table of contents again. And what I'm going to do, I'm going to look here in this chapter, the yeast chapter. And in here, I've put an article together called Superior Probiotic Immune Function and Intestine Health, okay? take a look at this article, and what we're featuring is a product called Prescript Assist Pro. And the reason many of you may have found it frustrating that when you look at our website, we may tell you the type of product to take. We give you the generic names of it, like curcumin, instead of saying that it's sold as a product that we prefer called Mariva 500. Okay. The reason that we no longer are able to actually give you product names is that most of the supplements that we recommend do not have adequate or actually don't have a lot of human-based studies to show that they work, okay? And the Food and Drug Administration says that we cannot give product names unless there seems to be more scientific foundation than they actually exist for many probiotics, all right? But with this Prescript Assist Pro, there actually is quite a bit of information, so we can put the product named on here, okay? So this is the probiotic we prefer. I'm starting to shift most of my patients to this probiotic, and in fact, you can even tell you where to get it, and I'm just going to take you there, okay? So this, everyone, is the supplement site where we keep any supplement that I recommend for you, okay? This is what our patients use at Marty Ross MD and Terrabrook ND Supplements. If we read our articles and we say, take curcumin, come here. You can look and see what our curcumin product is by just going ahead and clicking on the search function here. Okay? So you may be interested in using the products that we recommend here because we have hand selected these based on the products we think have the most active ingredients, all right? And number two, the ones that are shown not to have a lot of artificial additives that could harm you. Okay, yes, artificial additives could harm you in Lyme because they can be toxic in situations, okay? So if you're looking for where you can find the supplements that we use with our patients, I know I get written questions frequently about where do I find the best supplement? Well, take a look here, but just be aware we're no longer allowed to do that for most products on in the Treat Lyme book, okay? And that's because of Food and Drug Administration and Federal Trade Commission law, all right? All right, so let me go back here. Okay, so I know that it's a little long-winded, but I hope that answers your question, Jane. Oh, I'm sorry, one more thing. On the with the earth-based probiotic, I parasitic again because soil-based probiotics can have parasites in them. And so what I would do is take them at least 2 hours, 3 hours away from your antiparasitic, okay? All right, thanks for that question. All right. Kim, I'm sorry. I'm sorry if you got knocked out of the group. I know this looks like the same webinar system to many of you who've been here before, but they changed the behind the scenes part of it. And I've had some problems here. I think I've got them ironed out. So anyone that I bumped off accidentally, I'm sorry. And for those of you that followed me to the new link, I'm glad. I don't think we'll have that problem next week. So thank you for bearing with me here. All right. And Kim, I'm sorry if I bumped you out there. All right, let's see here. All right, let me keep working through it here. Aiden, I have something from you that says no sound. I have not gotten that as a complaint from other people. And actually, I think so if anyone, I hope that if anyone is having a problem, that they'll write me a message on that, but I guess you can hear it. Let me just type a message to everyone and see if you can get it. So I'm going to say, can you hear me? And let's see if I get some responses back on that. I think we may find out here in a second. All right, so Aiden, thank you for that. All right, very good. Okay, thanks. Oh, I'm having a hard time typing here. Just a minute. Okay, thank you for your feedback, everyone. Okay, so good, good, good. Thanks, everyone. I appreciate you bearing with me as I try to figure out this thing. All right, so let's see. Nicole is up next. Nicole, let me go ahead and share your question here. Okay. I have dual ALS and neurologic Lyme diagnosis. Oh, what is the best course of action? Been on oral antibiotics and now on IV Zithromax. Okay. So Nicole, I'm sorry, you're in a tough situation, obviously, and having Lou Gehrig's disease, everyone, which is amyotrophic lateral sclerosis, also called ALS, is a very complicated condition to treat. And it is caused in some people by Lyme disease. Okay. So, Nicole, I know you're using both terms, but you could use it either way. You could say you have